Hi guys, Dr. Robert Stevens here from the Men's Health Clinic. Today we're going to be talking about the benefits of testosterone replacement therapy. Now, what do you think the benefits are? Because you hear all sorts of different things from different people. You've got the media trivializing testosterone replacement therapy, saying it's all about muscles and a flagging libido, being grumpy. You've got the private sector who are trying to tell you you're going to get buff, be a stallion in the bedroom, and you've got the NHS who, unfortunately, let's not go there. So really, we need to dispel some myths and actually have an accurate discussion about what the benefits of testosterone replacement therapy are. Now, those benefits are simply normalising your estrogen levels. All we're trying to do is help facilitate growth and repair. Testosterone is an anabolic hormone. It is a steroid. It is an anabolic steroid. But in testosterone replacement therapy, its use is to normalise and optimise your levels so you can function. So, when we think about the benefits of testosterone replacement therapy, it's probably first better to actually identify the problems that you might have if you have low testosterone. Because you shouldn't receive testosterone replacement therapy unless you have a confirmed diagnosis, unless you have a proper workup by a proper clinician. So, symptoms of low testosterone. Now, you'll have probably read them a million times, but to go over them once again: brain fog, decreased cognitive function, lack of libido, erectile dysfunction, increase in body fat. The list goes on, but essentially what we need to do is identify what are the symptoms that you're suffering from and identify whether there is a reversible cause. Now, it isn't always as simple as saying testosterone replacement therapy is going to sort you out. So you have to have realistic expectations. It's important to appreciate that there are multifactorial elements in everything in health. So, we say this ad nauseum, the fundamentals of health: lifestyle, nutrition, exercise, hormonal health after that, and then modern medicine. So, let's break this down. What do you want to achieve? And that answer should be normality. It shouldn't be getting buff in the gym. It shouldn't be a stand in the bedroom. It should be normality. The primary function of testosterone replacement therapy is growth and repair to help facilitate homeostasis, a complex process that helps maintain stability within the body. Once you've achieved that, then you will feel the qualitative benefits of testosterone replacement therapy. But you'll only feel them if you address everything else: lifestyle, nutrition, exercise. Just repeat myself constantly because that message needs to get into you. There are plenty of guys out there with low testosterone who feel like rubbish because their diet's not in check, they're not exercising, their lifestyle's chaotic. It isn't a one-size-fits-all medication that's going to make you feel amazing. It's literally about getting you back to normal. We run a testosterone TRT in the UK Facebook group, and we posed that question to them: what has testosterone done for you? What did you feel the most benefit was? And as I said, if you listen to the media, it's all about erections and muscle mass. But actually, over 50% of our guys said energy and overall feeling of vitality, improved cognitive function, feeling myself again, happier, calmer. Then it was increased sex drive, stronger erections. It was 1 or 2%. So we're listening to the wrong people. Well, you're listening to the wrong people. You just need to appreciate that actually the guys that are optimized on testosterone replacement therapy obviously they're interested in sex, and they're interested in erections, and they're interested in muscle mass. But that's not what they really want. They want to feel like themselves again, because that's what it's all about. So, when you start testosterone replacement therapy, it isn't a one-size-fits-all model. You will not feel, well, you may feel amazing after a couple of weeks, but that's probably a placebo effect, and you might feel some positive benefits of HCG. But it takes time. It takes time because you need to stabilize your levels. Now, without going into the pharmacokinetics and pharmacodynamics, that process, even with the perfect dose, will not get you exactly where you need to be within 3-4 weeks. So we're all different, we're all unique. It's a slow evolving process. And the thing is, you need to appreciate that. You need to appreciate that there are risks associated with testosterone replacement therapy, but those risks are minimal when you're managed correctly. The idea behind testosterone replacement therapy, again, one more time, is normalization. Now, we're pretty good. We get you there in the end, hopefully. But it takes time sometimes. So, it isn't this sort of miracle cure that's going to make you the stallion. It isn't this miracle cure that's going to make you the brain of Britain. It literally requires work. And I think that's the thing that people don't appreciate. We will work with you. I will get you there. But you need to work with me. So you need to do everything that we've talked about ad nauseum: nutrition, lifestyle, exercise. It's an evolving process. It's all about the journey. It's not about the destination. It's all about the journey and just making sure you have realistic expectations. TRT does work if you're managed properly and if you appreciate the fact that it isn't a miracle cure. You should only go on testosterone replacement therapy if you have a confirmed deficiency. I see a lot of guys who we end up not giving them testosterone replacement therapy. You have to look at sort of other factors like low thyroid that can contribute to suppression of the GnRH, which can cause a secondary hypogonadism. It isn't always, even with a diagnosis, you measure your LH and your FSH and you get a diagnosis, but there are potentially reversible causes that would prevent you from needing to go on testosterone replacement therapy. Why would you subject yourself to twice weekly injections or injections every other day or daily injections if you have a lower HPG? Why would you do that unnecessarily if you could find a reversible cause? It's nonsensical. So, when you enter into this, you need to enter into this eyes wide open, because this takes commitment. This isn't a simple fix. You need to be fully aware of what you're getting yourselves into, because as much as testosterone replacement therapy can be life-changing, and it is life-changing for a lot of people, we've just started a campaign called Choose TRT, and the reason why we've done that is there's lots of reasons, but I've had a couple of guys recently who said that they wouldn't be here without me. They found somebody to listen to them. We've got them optimized on testosterone replacement therapy, and their depression has lifted. Again, it's not just testosterone. They've had to work at it as well. So they've had to work at sort of all the positive things that they need to concentrate rather than concentrate on the negative. And testosterone can do that for you. Testosterone can change your mindset so that you concentrate on the right things so that you can take that next step forwards. So when we thought about starting the campaign, it was just to highlight the significance of testosterone replacement therapy, what impact it can have on your mental health. When I hear all this crap from the media about it's about muscles and low libido, it irritates me. It irritates me to the point where I'm angry, because if you speak to my guys, if you see the profound effect that testosterone replacement therapy can have on your mental health and your physical health, you wouldn't be so flippant about the whole thing. And you would understand that you should be in this for the right reasons. So, yeah, the benefits of testosterone replacement therapy, it's not really the right question or the right statement, because what we're doing is hopefully just normalising you, optimising you, and making you feel like you again. So, on a final note, please follow us and subscribe to the hashtag #ChooseTRT, which highlights the importance of mental health and hormonal health, and together we can effect a positive change. Ta-da!